Okay, I originally went to a local urologist with symptoms of urination, just, flow kinds of things, and I decided I'd see a urologist because I knew that enlarged prostate was a common problem for people my age. I went there, he gave me a digital rectal exam, found a mass, suggested we do a biopsy. They did a biopsy, found one small cancer spot, 0.5 millimeter, with a Gleason score of 6. Based upon that, he recommended that I do nothing, basically watchful waiting, based upon the fact that he said many people are overtreated and we treat it more aggressively in the United States than they do, for example, in Europe. My daughter, who works at NYU, works for Bill Carroll in the cancer division, suggested that I come here, get a second opinion. Dr. Carroll suggested Dr. Lepore as the best guy to go see about prostate cancer. I went in, spoke to him. He told me that based upon what he had seen from the biopsy, that there was a range of options that I had, and he laid them out for me. Everything from traditional surgery, laparoscopic surgery, radiation, or watchful waiting. And he said that I fell on the borderline. Had I been 10 years older, definitely they would have done nothing. Had I been 10 years younger, they would have definitely suggested removing the prostate. So it was kind of an ambiguous situation. And I wasn't sure which way to go, so he sent me home, said, think about it for a while, come back. When I came back, he said, well, rather than deciding surgery or no surgery at this point, why don't we do some additional diagnostic tests? He recommended doing an MRI to see if there are any masses in or around my prostate, and also to do additional biopsy of the prostate, because he said in many cases when he's done surgery on people who only had 1 or 2 cancer areas when they had a biopsy, frequently he found that there was more in the prostate when they actually removed it and did the full test. And this way, if I did have surgery, at least I would be sure about it. But also, if they didn't find anything, he said, well, we wouldn't do surgery based upon just that one small area. What we would do probably is, in one way or another, kill the cells just in that one small center. So I had a second biopsy, and I had an MRI. The MRI found no additional masses other than the one they had found initially in my prostate. And when they did the second biopsy, they found that not only were there 3 additional areas where there was cancer, but it was on both sides of my prostate, which apparently indicates, that it has, it's more likely to spread. And the Gleason score was 8 as opposed to 6, and that was a significant difference. More aggressive form of cancer. Based upon that, Dr. Lepore suggested that I get surgery. Now, I still had an option for surgery. Would I get the laparoscopic surgery or go the more traditional route? I made the decision to go the more traditional route, basically based upon the experience of Dr. Lepore, having done, I guess close to 3,000 of these. And also based upon the fact that he felt that when you were opened up, that they had a better chance of seeing whether or not there was additional cancer outside the prostate. So I went ahead 4 weeks ago today and had the traditional surgery. When you hear you have cancer, it's sobering. I wouldn't say, I was never frightened, which frankly surprised me. I thought I would be more anxious, not only about the diagnosis, but also the surgery. I went into surgery, for example, with practically no anxiety. I guess because I trusted the people knew what they were doing. I mean, I know there's a small probability of problems, but I kind of felt I was in good health and the people were competent, so that didn't bother me. I liked the fact that when I went to Dr. Cianti, I realized he was somebody who does this all the time. And when I had a 12-core biopsy the first time I did it. He did a 16-core biopsy, and I found it less discomfort when he did it. It was not a fun period. I actually found out the day before my birthday. I got the results of the first biopsy, which is, as I told you before, sobering. The process itself, again, it's never fun to have surgery. There's always some anxiety with this. I think I was, as I said, I was surprisingly more comfortable than I expected to be, because I felt that even though this was going to be a difficult time, I was facing it with people who knew what they were doing, and I was going to get the best possible care that I could. The surgery, the experience itself went, I guess, as well as you can expect surgery to go. I recall even on the operating table, and I told people about this, I was so impressed with the fact that while I think there were 6 people in the room and they were all very busy, but they took the time to ask me questions. One of the nurses asked me if I had any problems that would cause them to position me in a different way on the operating table, which no one's ever done that before. You know, they said to me, you know, we'll make sure that we do it in such a way that doesn't, you know, make you uncomfortable. And the other thing that I really liked was when it was all over and they were ready to go, they asked me if I was ready, which is a nice little touch, rather than just, you know, lights going out. And at that point, I was ready. I said, let's go. All of the people that I've dealt with, including the doctors, but the nurses and technicians as well, have all been extremely competent, but also showed a sense of caring, which I found to be helpful. You know, you go through the process, for instance, of removing a catheter, which isn't any fun, and when I went through that as well, you know, people were careful to treat me in a way that I thought showed respect and caring. And so that was also positive. I think everybody I've dealt with has been very professional. The range of treatment options, the fact that there were experienced physicians in each of those treatment options, so I wouldn't be taking somebody who didn't do many of whatever I was going to get. And just all of the resources and facilities I found were first class. And so to me, that was a comforting feeling to know that I had options and all of them had experienced people behind them. So whatever option I chose, I was going to have the best possible care that I could get.